Good afternoon, everyone. I guess it's 3 minutes after, so we can go on and get started if it's all right. Is that all right, Laura?
Sounds great, Kim.
All right. So good afternoon. My name is Kimberly Bugg, and I am the Community Engagement Director for CHAMP. It has been an absolute pleasure working with this program, this project, and the women we have been able to engage in the community. I do have an ask of you all, and that is that you will, at the end of these presentations, each one of you have at least one question or one comment or one thing you would like to ask us. Again, as we continue on this journey, what we know is that we are all in this together, and we are having a fabulous time engaging the community, but there's so much that we need to learn. So we would like to learn from you as we hope that you will learn a few things from us too. So again, it is my ask that you will at least have a comment to tell us something you're doing or a question about what it is that we're doing. So with that said, we will talk about the community in CHAMP. Oh, of course I didn't hit the right button. So our task has been to engage these 4 areas in the projects and programs that we're doing. So we're going to be talking a lot today about peers and the partners that we have engaged in the community in CHAMP. So we call our peers mother-to-mother support community transformers, because we truly do believe that they are changing the lives of their community, their friends, their relatives. So the community must be engaged for change to occur. We let them know that to effectively orchestrate change, we have to continue to learn from and be engaged with those in the community. We have to be good listeners, and we have to learn. We don't do things to the community. It is our goal to work with the community and helping them to meet their goals. So we have had the opportunity to present a couple of community transformer trainings in Louisiana, and we also did one very recently, and that was the second one. So for the first year in CHAMPS, we did one, and we recently did one last month also. These ladies are absolutely phenomenal, and they have been reaching out in their communities to do different little tasks. We were invited to work with them at the Essence Festival last summer. They have been doing Mocha Mom cafes. They've been doing support groups, support clubs throughout the city. So the community transformers in Louisiana have also been part of our CHAMPS conferences when we come there. They've done a mother panel with us, and also have worked with and talked to some administrators in the hospital about their birth experience when they did birth at the hospitals, and some of the interesting things that went on with them in breastfeeding in the hospital. So we're hoping that they are continuing to transform their local communities and also their hospital communities. We've spent some time in Jackson, Mississippi doing the community transformer training. And again, what the transformers are local women, and our goal is who have breastfed for at least 6 months and have had a positive experience and is willing to work with and share that experience with their communities. Because they come from the communities they're in, they tend to be trusted allies in the community, and therefore are able to effectively affect change in their neighborhoods. So we have also worked together on the CHAMPS program to, as we mentioned, to work with several what we call parent panels. These are sort of some of our favorite things to do, because it's really kind of amazing how far apart at times administration and nurses are with the real experiences of the ladies that deliver in their facilities. One of the things that Ann mentions a lot when we first get started with a lot of our trainings of healthcare providers is that women really do want to breastfeed. What we hear so much from the places that we visit is that these women don't want to breastfeed. And, of course, we're getting exactly opposite from the communities. So it is important that the hospital administrators, the nurses, and the physicians get the information from the women that they serve. It's, again, more strong coming from the women that actually deliver in their facilities. So we have truly had wonderful success with our parent panel to let the hospitals and the healthcare providers know what the true birthing experiences and breastfeeding experiences of the moms are in the hospitals. Other partners that we are working to engage are the fathers and the partners and the husbands of the women who we serve. And we are reaching out to the male partners and have found quite a bit that many times men feel like they are invisible or undervalued in the whole process, especially in the hospital. The fathers tell us that they feel totally ignored, that, you know, occasionally they're kind of sitting over in the corner and everyone's doing things with the mom and for the mom, and a lot of times they don't even speak to him or acknowledge them. So in our practices, this is something that we definitely need to make ourselves aware of, because men don't like to be ignored. And, you know, we talk a lot of times about fathers, especially men of color, not being present, but I guarantee you that if you ignore them, they will not be there if we don't acknowledge them. So working with partners, again, is something that we definitely are engaging with the CHAMPS program. This is a dad that was in the Mississippi Delta, and he actually came the second day of the Community Transformer training because his wife had gone home telling him about all the fun that she was having, and he wanted to be sure that, you know, learning was going on too. So this really was an amazing young man, and he has sort of been in touch and has continued to promote breastfeeding and been an advocate for breastfeeding with us. So we wanted to make sure that he understood why breastfeeding is important, and he was just saying that he was just supporting his wife, but he really did appreciate getting the information about how important this can be to the health and welfare of his baby and also the health and welfare of his wife. Faith-based initiatives are something that we have our community transformers reach out to as much as possible, particularly in the African American community. Faith-based worship is very important, and we have found that this is a major barrier occasionally in our communities, that the churches are not a safe place or a comfortable place for women to breastfeed their babies many times, that they get negative reactions, negative responses, mean things said to them, like, you know, don't you want to go to the bathroom and do that? So it is very important to us, especially in the states that we are working in and reaching out to make sure that we incorporate a faith-based initiative. Some of the things that we have done is reached out to, especially in New Orleans, Dr. Fred Luter, who was the first African-American president of the Southern Baptist Convention, which is, you know, thousands of churches. And so we have reached out to him, and he's been a very strong advocate. And it was just really wonderful that his church, which is a very large church, Franklin Street Baptist Church in New Orleans, was in New Orleans, so that we could have that connection with him. And very recently, we've been reaching out to some others also in Mississippi and in Louisiana. So, reaching out to the health ministries, to the women's groups, to the young adult groups, to the you know, the mothers groups, to the deacons, also participating in health fairs that many of the churches have is something that we've been sure to do, and also enlisting other partners. This is our partner slide, working with grandmothers, with aunties, and we always say that, you know, aunties are not quite mothers and they're not quite sisters. They're that cool person that's in the middle of those. And so aunties are someone that we've been really, truly focusing on to bring in the fold of breastfeeding awareness and protection, support, and encouragement for their nieces and their nephews, and also sisters. So those are partners that we in CHAMP are working on, engaging in this whole process of moving the needle to make sure that vulnerable populations get the information, get the encouragement and support that they need to meet their breastfeeding goals and start breastfeeding. So we want to make sure that we are providing guidance on how to help their daughters, their nieces, and their sisters in those faith-based communities. All right, I'm going to click on this side. So there are also about 200-300 scriptures in the Bible on breastfeeding. So this is something that we take around with us as we travel the Bible Belt in the South and make them available to especially the pastors, but, you know, the deacons, the trustees, all those types of people, to let them know that, you know, breastfeeding is normal. Breastfeeding was in the Bible. So this has been a wonderful tool for us to be able to use. Policy, as far as the community is engaged, to make sure that the community is aware of initiatives going on nationally, statewide, and locally. There are some pilot programs we're aware of that the National WIC Association is looking at, that they're engaging women that are not WIC participants and assisting them with breastfeeding concerns. So that's going to be really important, because what we know is that as women are discharged from the hospitals, they are, with step 10, they are all being encouraged, of course, to contact WIC. And in many places, WIC has not been at the table, so they don't know what they're being told. But besides women who are WIC eligible, there are many who are not WIC eligible who also need a place to contact if they're having breastfeeding concerns or problems or, you know, just questions. And so that's going to be a huge resource for us. And so we're happy that, you know, we were part of getting some of that stuff going, and that that's something that we hopefully will be able to support quite a bit. Also, every state has a breastfeeding coalition, which are usually part of the United States Breastfeeding Committee. And breastfeeding coalitions are a great place also for the community to be engaged in. So these are some of the policies that we work on with our peer counselors to make sure they are aware of the initiatives, the programs, and the processes that are going on in these couple of agencies and any other local ones that are going on, so that they can further their breastfeeding information and learning also. So some of the other things that we're doing in the community is, this was just, when we're doing a community transformer training in Mississippi, we just had the opportunity to stop by and have lunch with some nurses at one of the hospitals. And so we had lunch with them and talked about breastfeeding for about an hour to truly help them to understand that baby-friendly wasn't going to be something that was real spooky and just kind of out there, that it really is organized and controlled and will change maternal practices for the better, and also for them also. So this was a great little visit that we had in the Mississippi Delta with some wonderful, wonderful registered nurses. We had a ball. So advancing change, establishing relationships between the community and hospitals seeking baby-friendly designation, particularly in the South, is what we're doing. Educating our communities on the importance of Step 10 with baby-friendly hospitals, educating women on the importance of breastfeeding is what we are doing in the community. So we want to make this change so that we don't have all those babies lined up in the nursery, that the babies are with their moms immediately, which right away changes a lot of things, especially with breastfeeding, initiation and duration of breastfeeding when babies are put skin to skin immediately. So this is a change that we are trying to affect, and isn't he cute? A couple of other things is the breastfeeding clubs that we are doing all over, and our peer counselors or community transformers are having breastfeeding clubs in libraries and hospitals, and Babies R Us, again in their churches, just any place that they can. And next step is that we are going to continue to do training of professionals, and one of our goals is to actually continue to train IBCLCs of color in all of these states so that we can assure that there are the levels of breastfeeding support for the mothers when they come out of the hospitals. We know that if they are properly prepared when going into the hospital, they get out of the hospitals being successful. Usually that's going to cut down on the majority of the problems that they have, but if not, we want to be sure that there are also CLCs and IBCLCs of color in the community that can culturally appropriately address their concerns. So social media is something a way that we use to reach out to the community transformers. We have Facebook sites, and they do Twitter. and they have WebInEx once a month to keep them up to date with what's going on and to address their concerns. So with all that said, we know that stress is when the demand doesn't meet the resources, and so we want to make sure that the proper resources are in the community to meet the demand, and there's going to be much more demand coming out of all these wonderful designated soon baby-friendly hospitals. So we want to decrease stress by making sure that the community is prepared, that we have different levels of breastfeeding providers and support, and that moms, if they have questions, comments, concerns, problems, are able to access those resources. And that is all that I have for you this afternoon. So I'm hoping that you have formulated your question, and when Roger is finished, we will get to those. Thank you.
Thank you, Kim. All right. So I'm Roger Edwards, and I'll be sharing with you what has gone on in Massachusetts and some of the work funded by the CDC. I think the slides will be coming up momentarily. They're not on my screen yet.
If you just advance the slides, it's all in one slide set.
Got it. All right, there we go.
Okay, great.
Thank you. Great. And what we want to talk about is some of the, Kim shared with you what she's done in Georgia with the Community Transformers and how she's extending that into the CHAMPS program. And I'd like to share with you some of the work we did in Massachusetts and how we're applying it in the CHAMPS program as well. The work I'll be describing in this presentation has been published in the Journal of Human Lactation as part of a special issue that the CDC has sponsored. And that issue has been e-published in the past few months. Our article came out in August. But the entire printed issue came out this month in November. And from all 6 states, the CDC funded as part of the work. And so I'll be presenting a team effort here related to that work. And I have no other disclosures except beyond the work I do with CHAMPS and the work that I've just finished with the Massachusetts Department of Public Health. What CDC's had to do with this work was to really provide supplemental funding as part of the Nutrition, Physical Activity, and Obesity program related to breastfeeding as an obesity prevention strategy, and then really bringing in this emphasis on post-discharge support, particularly for vulnerable populations. We know there's a lot of importance and resources being devoted to the hospital, but the goal behind this effort was to really make sure we include all the things that happen prenatally and after discharge, and really getting that continuity of care concept as part of the support that mothers have. And this work was done when I was at Northeastern University as part of that effort. The goals of this original work that we did in Massachusetts specifically focused on creation of community care teams. And in that case, we actually had Catalyst grants that the state gave out 2 different community teams within the, across Massachusetts. And we identified teams that included communities that were part of a broader obesity prevention program in Massachusetts called Mass in Motion that focused on nutrition and physical activity. And I think this was an important component, is to really think about breastfeeding as a broader community health consideration, so that it's put in the context of healthy food, healthy activity, and well-being for not just the mothers and the infants, but for all members of the community, because we elevate the entire community by focusing our attention on the mothers and the infants as part of that effort. It's a community-level activity. And I'll talk about that work in more detail in a moment. The grant included some other work related to continuing professional education that I won't be discussing. It is in the Journal of Human Lactation, and I will note, and the link to it is on the CHAMPS website, but I will note too that over 4,000 physicians and nurses have completed this continuing education since it began almost 2 years ago. So we're excited about that reach with that, and some of you are already familiar with that from other CHAMPS work. The third part of it related to discharge planning and review of all the discharge packets and really promoting the availability of support resources for that. And I'll touch on that at the end of this presentation. Overall, the work, we know it's really challenging to work across organizations. We know it's critical, and we know it affects all parts of health and healthcare, not just, of course, maternal and child health and breastfeeding. So for this project, we actually had 104 organizations involved in the work, described as you see here. I won't go through them, and they reflect a broad diversity of organizations' involvement. And I think that's what the nature of this health state is in our infants' health and breastfeeding and our mother's health is really, it involves a wide range of community organizations, and they're very critical to provide that continuity of care. In addition to that, we really had a strong focus on underserved populations. Specifically in Massachusetts, we want to get an overrepresentation of Black, non-Hispanic communities, Hispanic communities, as well as communities that have a higher proportion of patients receiving public support for their health care and so forth. So you see here what we did in the state overall, as well as what we accomplished with this project, really targeting communities that had 83% more Blacks and 60% more Hispanics than the state average, as well as 50% more on public payment. And that was really important. The goal behind this, some of you have seen this article, others have not, by Gibson Forrest, that really document the value of focusing on the vulnerable populations as part of this work and why we all benefit from that, and how important breastfeeding is in really addressing disparities longer term. I think this is recognized by many within the breastfeeding community, but I don't think it's recognized as much as it could be by community more broadly. So we have found that in educating hospital administrators and educating mayors and other communities more broadly, community members more broadly, to really bring these points out to them about the role breastfeeding can play at a broader community level. And this article has quite been a useful resource to that end. For those of you familiar with Massachusetts, we try to get a broad section of the state represented geographically, from the western part of the state in the north central, as well as the central and suburban Boston, in addition to Boston. And you see here that we had 6 teams that received the Catalyst grant process, and then we had 3 that were centered around the baby cafe concept, and each of these baby cafes was located in a federally qualified community health center to really bring together the resources of the FQHCs with the baby cafe to really provide the access that's otherwise very hard to accomplish. So what these Catalyst grants did and they had monthly phone calls with Northeastern staff and breastfeeding experts. So we brought together a diverse team to work with the communities to create a different kinds of services. And the goal here was that every community is different. Not one size does not fit all. So we had to actually tailor the support that they needed and the resources to what they were trying to accomplish in the specific community. So in some cases, 4 of the groups actually created new support groups, as you see in that first row there. 4 of them also actually did some staff training for the people providing the services as part of their Catalyst grant. 2 got involved in free transportation, felt that was an unmet need in their communities, really important, and 2 looked at how to use child care facilities to be more supportive, and going on down the list, the grandparent kit, a drop-in clinic, and actually even using software to better track what's going on and measure what's going on, and I'll come back to measurement in a moment. In every case, what we found that was an important aspect of that is it wasn't always starting new services, it was better utilizing existing capabilities. The marketing of existing capabilities, supplemental staff to existing capabilities, and that was a key aspect of the resources. So in some cases, many of you might have things started, but they're not being fully utilized. And we found that the concept of really providing additional resources was helpful in enhancing what's already there and making it more widely available. We have some measures related to what we looked at in this area. You see there the number of women who gave birth in 2003 when we did the project, and the number of women who breastfed and received breastfeeding support. The difference between those two rows is the women who were exclusively formula feeding. It gets a little bit challenging in Massachusetts because you have hospitals with overlapping service areas, so that you have a mother who might deliver at one hospital but then receive breastfeeding support at another hospitals or another community support group. And so it became challenging to identify unique interactions, so we had to just look at the number of women who received support in the first 2 months after discharge and then 2 months or more after that. So we could really only track mother contacts with the project as opposed to unique interactions, and that's a challenge with any community-based care. It happens in other parts of healthcare to try to look at that. And so you see here we had pretty good reach. We could not separate exactly the number that were unique to the additional grant because of the enhanced marketing as part of that. So that's a challenge that comes up with process measures and measurement, and it's always difficult. So I'll touch on how we handled that going forward with terms of measuring community effects, because we do all this community work, we know it's important, but how do we measure its effects? And it's quite challenging. All right. So what we did is we looked at the literature, and we found that the CDC had funded a nice program in asthma, which also involves a large community component. And we saw that there had been a whole program developed around community added values. Community coalition added values and what those consisted of. And so we took that same framework, and in this case you look at the individual level, what had happened in terms of individual people getting more training. Then you looked at changes within the organizations that were part of your program, the member organizations, and counted that as a benefit. Then you looked at new things generated by the community teams as part of this effort. And then looking at the better linkages among the member organizations. So you actually had, mothers who might have gathered for a breastfeeding support group, then taking walks together as part of a physical activity intervention through the Massive Motion program, for example. And then we actually looked at linkages that had happened beyond the members of the team, further out. That's that next darkened circle where we had 22 examples. We did not see any evidence in changes in other non-member organizations or at the legislation or regulation level. Of course, unlikely that we would in a one-year grant. But it gives a way of tallying this, and all the supporting details of this I can cover in questions, but it's also available in the JHL article with the supplemental materials with that. But it's important for us to document these changes at the community level and keep track of it so that people understand, why do we invest in community? Here's how we're keeping track of it. Yes, they are imperfect measures, but if we expect to maintain resources for this kind of work, we have to deal with this program evaluation and these measurement aspects. Finally, I'll just touch on some of the work that we did with FitMilk and the promotional outreach with social media, and give you a sense of some of the resources that we have here in Massachusetts to support that. Whether you have, and I know 6 states have FitMilk, other states have other similar or equivalent things, and the hospitals were able to use that material, and we tracked their discharge packets to make sure that they were including it to try to help provide mothers with the resources. Again, it's this notion of what is available. People don't always use any particular resource, but knowing it's available creates a mindset of, and support the self-efficacy and the ability of the mothers to successfully breastfeed. It's really, the frame of this is it's important to maintain it's a societal community issue, not just a mother and infant issue. Overall, what did we learn on this project? We learned that there's no single solution, that each situation has to be customized and tailored to make it work. And stakeholders were always not aware of breastfeeding as an obesity prevention strategy. I think that the more we can put breastfeeding in the broader context of maternal and child health, looking to other perinatal quality improvement efforts, looking to other obesity prevention efforts, really puts it in the context for the broad impacts that it has. I mean, short of exercise, we can hardly think of anything else that has as much health benefit as breastfeeding for both the mothers and the infants, and that's important to begin to integrate it further. The other thing that it was very hard to do this work in a one-year time frame. We all live with the constraints of funding, but to the extent that we can do multi-year work, the better. And finally, the idea of collecting data on community activities is very challenging. As many of you know, I have had phone calls with many of you who are participating in CHAMPS to collect baseline data about what community interactions you have and how those might evolve over the 3-year project on the CHAMPS project to think through and what we can do with that. Now, I know Emily Taylor's worked with many of you on the hospital-based care, and we're not tracking some of that in the community, but hopefully with future work we might be able to. I think I'm to the end. So Kim and I are available for questions. I went through a lot of material quickly, but I wanted to leave a lot of time for us to have discussion, as Kim noted. So Laura, I think you'll be moderating the questions. I don't know if you're looking at chat areas as well as phone calls, unmuting everyone.
Yes, sure. I'll look in the chat box. So if you'd rather write in your question, you can do that. And then I'm also, I can go ahead and unmute everyone. And then if it just seems like a lot of, and then if you do want to be muted, please go ahead and remute yourself, okay? I hear a baby. Okay. Okay, so all the lines are unmuted, so you should be able to go ahead and ask your questions. Or again, if you feel more comfortable typing it into the chat box, you can go ahead and use that method.
So is there anyone willing to share what type of community engagement is going on near you to support the moms after those 2 or 3 days they're in the hospital? Can someone share some great ideas that's happening near you?
Hi, Kim. This is Susan Spencer from Baptist Hospital Golden Triangle in Columbus. We saw you just last week.
Yes.
There's nothing fabulous going on here. We're struggling with the community efforts. We do have really great WIC counselors and WIC representatives. We don't have yet a solid way to send moms home with information that says this is your one call, this is your number that can get you connected. We do actually for Mississippi and for our area, I think we have really strong LaLeche representation, but as we talked about last week, women of color often don't get involved with LaLeche. Another issue that we have is our biggest LaLeche group is at Columbus Air Force Base, which makes it a little bit exclusive to moms in the community. So we will be working to put together a handout and discussion that we can give the parents. I don't know what the best way to reach out to them is. When they're being discharged, they're getting so much information, but we don't have anything solid that we give them with, excuse me, I'm a lactation consultant. We have another lactation consultant actually in hospital. We happily see people after they're discharged. But if they fall out of the loop and they don't get that information to make the phone call to us, then they don't know we're available. The other thing is I think we need a closer connection with WIC so that we readily give out that information. Another thing is I'm excited to hear about the nurses of color reaching out to the churches and getting groups going for people that, even if they're associated with WIC, it's still like, you know, the club atmosphere is very promising.
Great. Yeah. As far as connections with WIC, we can definitely help to make those local connections in your area, because as we said before, it's important to get all these folks at the table early on. We don't want to, develop and design things and then say, oh, yeah, you all come in and they have some, wonderful stuff to offer that could have been used earlier. And also, CHAMPS is also looking at being able to assist you to develop, culturally appropriate or, geographically appropriate materials for your mom, because, of course, a lot of this has got to start prenatally. And so as we're starting this and revving it up, we're going to start to nurture champions throughout the process, prenatal folks and, folks in the hospital and folks in the community, so that we're going to build those communities so that there will be many people for them to reach out, because, one entity cannot definitely do it all. But the CHAMPS project is definitely able to help you with a lot of those concerns, and it's going to be really wonderful, too, for you to be connected with. You may even find that there's some other, community-based organizations out there doing some things as we can start to reach out. So I'm really happy to hear your voice, and, we've talked about CHAMPS coming there and helping you get started, and we're definitely willing to do that, too.
Awesome. Okay. And I think as far as my connection with WIC, I feel very close. I'm on the North Mississippi Breastfeeding Coalition, and I get lots of interaction, but I want the staff nurses, the ones who are at the bedside, to feel that connection with the WIC representatives, so it is a really easy flow of information for that part of the community, but also beyond that, finding things that we can do.
Yeah, and the whole process is about policies, because, once the policies are in place, is that we do this, this, and this, then those things are going to flow. Just like the staff, you're not going to be the only one, working and touching those breastfeeding moms. When we start to go through the designation process, you're going to be able to send a lot of that stuff that you do every day to the staff nurses. So, yeah, everybody's going to be involved. A great question. Anyone else have some things going on in your area?
Hi, my name is Sharon Marshall Taylor from the Brooklyn Breastfeeding and Empowerment Zone in Brooklyn, New York.
Hi.
Hi, how are you?
Great.
So we have lots of services. It's kind of continuity is really the challenge. The Empowerment Zone is housed within the Department of Health in one of our local district offices. And so we have a newborn home visiting program where moms within this catchment area are entitled to 2 breastfeeding consultations. So they have public health advisors that do go to homes and do 2 observations. We also have some great WIC programming as well. And then, but the challenge is really building the bridge between the hospitals, WIC, and newborn, which has a little bit more opportunity to work within the hospitals because it's the health department. WIC works with them, but the flow just seems to be a challenge, and the opportunity for community members to be part of the breastfeeding support team beyond being a WIC peer counselor. So we've trained people to become doulas and to become CLCs. I'm also looking for community breastfeeding educator training for there to be a win at the level of readiness of community members, because CLC could be quite involved for some community members. So it's really having community be able to be partners and for them to be trusted partners as far as who the facilities like the FQHCs and hospitals would refer to. And so it's developing that trust. It is the bigger challenge, and it takes time. And so many of these initiatives are short initiatives, and as you're trying to build a coalition of not just providers, but of community members, you know, there's a process in developing that trust to get that continuity going, so whatever time of day a mom can get some sort of assistance.
Wow, that's excellent. Definitely is about relationships in the community. And you know Lorraine Boyd?
Absolutely.
And Elisa Maybanks?
Yes, that's my boss.
Okay. So those are both people that we have worked with, and so we are very familiar with what's going on. And you all have done some really, really great work, and especially with your faith-based initiative. Are you familiar with that and the information that they have?
Yes, so I do the 2.0 of the faith-based initiatives where we kind of double down on two particular communities. Yeah.
Okay. So, I mean, and that's something that this group could, you know, with what we're doing in Louisiana and Mississippi and Texas, could really gain a lot of sort of, you know, momentum behind, because you all have a phenomenal faith-based initiative. And so I'm glad that you're on here. That is definitely something that we would like to reach out to you and get your information, because they have lots of really printed, great information, guys, on faith-based initiatives with CDs and posters and all that stuff. So the bottom line is y'all really are doing phenomenal, you know. and
I still feel that there's work to be done. And
all this stuff, you know, that needs to be done. But I know that on the ground you all have done some phenomenal things, and we're striving to get there. So I just have to affirm you and say that. But thank you so much for being on here, and we would look forward to partnering and helping you how we can and getting some of your stuff, too.
Yes, definitely. Thank you so much. I also have a quick question if no one else is calling in. Have you worked with local businesses to provide some sort of education to them? Most of our moms work in low-wage retail, things like that, and many of them say that because of their workplace policies or lack of a workplace policy, they either wean very quickly or they don't even bother to start.
Roger, you want to take that?
Sure. We actually have struggled with that ourselves here in Massachusetts on that in terms of, you know, some of the hospital tried to, one of the community teams actually tried to convene the employers as part of the Catalyst Grant process, and basically they said, yeah, we recognize it's an issue, but, you know, we have these bigger issues. And so the hospital ended up doing more by example of saying, look, this is what we're doing for our employees, and then to try to get it out there. I think it speaks to the broader societal issue. I know the business case of breastfeeding has some examples for it and so forth, but I think in order for it to really work on a local level, I think you have to just get to the people who are running those facilities and managing those things and try to figure out something to work out, because I think that we have found that the times where they've been frustrated is because they couldn't move someone, and the times they've been successful is because they got to the right person who could say, this is important to me in my store, in my facility, in my fast food restaurant, and we have to figure out how to do it. And I think that you know, some of the other larger organizations have the space and so forth. I think the big challenge is they don't physically have the space to do a lot, and so they're left with this tight constraint. And I think that's where the creative solutions come in. That's where some of the ways of barriers might be used to try to section off a section for that purpose of that mother to pump and so forth. And I do think that, you know, Kathy Carruthers has done a lot with showing some of the creative solutions people have to get privacy for the pumping. But nonetheless, I think it really comes down to the individual relationships to try to move things. But we've had some frustration as well in that area.
Yeah. Thank you.
Hi, this is Siobhan out of Hancock County with the Mississippi State Department of Health. I have a question.
Yes.
Okay. I think it's for Kim. Mostly, how frequently do you get your lactation specialist from the health department, if any at all, into the hospitals within the first 2 or 3 days after delivering the baby?
Okay, so how often do you get the lactation specialist in the hospital?
Or consultant, someone from the health department, because here in Hancock County, that's what I'm doing. In Mississippi, I go on certain days when they have the highest delivery days, which here is Wednesday and Friday, and I go in individually in all the moms' room, and I'm able to assist sometimes with the initial latch and initiate skin to skin.
Oh, wow. That is really cool. Actually, you know, we need more collaborations like that. And see, this is what we need to talk about because, you know, we have, you know, personnel in some cities that are doing things that other places are not. And so we truly just need to have the resources to know what is available and what's possible. Because, you know, with all hands on deck, if there are fewer lactation consultants in some places, and some people are able to do some hospital visits, that's phenomenal. But sometimes that isn't always, you know, we aren't able to do that. So we would like to know who also does home visits, who can go to the pediatrician's office. Those are the type of resources that we need written up so we can know what's going on where and look at the best practices and how that's really, you know, helping so that we can spread those initiatives to other places. So you work for WIC, right?
Yes, ma'am. And we are able to do home visits as long as the client calls us and they are a WIC client first. We are able to make a home visit, and we follow our breastfeeding moms for up to a year on the WIC coordinates.
Okay, see, now you need to write that up for us and send that to us just as an example. We need examples of stories, pictures of what, snapshots of what's going on in the communities so that we will know. That's great. I don't know if anyone else is doing that around. Do you all know other lactation specialists and hospitals? Is your WIC staff able to come in and see WIC moms in the hospital?
One of our hospitals in Brooklyn, yeah, does that.
Yeah, okay.
Yeah.
And there's a couple examples here in Massachusetts as well.
Mm-hmm.
Okay, so in Louisiana, in New Orleans, and in Mississippi, and in southern Texas, we really need to be able to outline those resources. And those of you who are doing it in other places, if you have MOUs or how you got that started, we would love to know. I know in Tennessee, is anyone on from Region 1 in Tennessee? Because I know at Region 1, they have a WIC clinic in the hospital. And so, you know, they are able to see moms there, but where that's not happening, a lot of our places, it isn't. And that's a great partnership. That's a great partnership. Also to have, you know, volunteer moms who, of course, are able to just talk with other moms to encourage them and come through the volunteer services is what some other places have said, too. So, thank you all very much.
Thank you.
I still need you all to chat in where you're from, because I'm trying to be nosy. So please just chat in your state in the chat box.
Can you hear me? This is Mary from University Hospital in San Antonio, Texas, and we have lactation consultants here in the hospital, and we do see patients every day. We also have a lactation consultant at one of our 13 clinics, the one that's downtown. There are WIC resources here in town, numerous WIC clinics where they're able to go in for help. And then we have the baby cafe with WIC that's free for anyone. There are some private hospitals around town that have lactation centers. But we still, for our population, it's really hard for them to get there. They have other children, you know, transportation concerns. But we're working on everything we can.
Sounds like you have a wide array of resources. So
Want more. And unfortunately, we don't go to their house, and I think that's what a lot of them really need.
Great. Well, Laura?
Hi. Hi, Kim.
Hey, I was just checking to see if there's anything we need before we say goodbye.
No, I think our time's almost up, so we could just say goodbye now, and then we'll post this webinar recording, too, on our website later if people want to review or share with their coworkers who weren't able to make it onto the call today. So thank you for joining, everyone, and we'll talk to you next month.